The 2020 South African Child Gauge report has revealed that South Africa has made minimal progress in eradicating child malnutrition in the past 20 years. The report and its authors call on the government to take action on malnutrition by increasing the child support grant, establishing the National Food and Nutrition Security Council, and drawing up a roadmap on how the constitutional rights of children will be fulfilled. Joining us now to talk about this is Dr. Chantel Witten of the University of the Free State Faculty of Health Sciences. Dr. Chantel, good evening and thank you very much for your time tonight on the Newsfeed Late Night.
Good evening, Tabo. Good evening to the viewers.
Now, this conversation emerged last year as well, around June 2020, as we were deep in the grips of the COVID-19 pandemic. And there was a voice that was saying, well, malnutrition, for example, cases have begun to even show up at the Chris Hani Baragwanath Hospital. The health minister, or the health ministry, shall I say, quickly came and rebutted that, saying actually they saw a drop in malnutrition cases in April and March last year at Baragwanath Hospital. Where does the truth really lie here?
Thank you, Tabo. Well, firstly, the truth lies in how we collect data. So at the time, we were aware that firstly, there was a lockdown. So not many children with their mothers were able to access the services. So therefore, there was a lot less children coming into the hospitals, particularly with what we call severe acute malnutrition. So the minister was correct. We did not have the data, but we were having reports from our civil society, our NGOs, and we could see in the media the number of people that were lining up for food. So we knew that hunger was on the increase. And the most recent NITS-CRAM data that was released yesterday showed that hunger has increased amongst our children. So at this point in time, we don't have data that confirms an increase in severe acute malnutrition, but we certainly have indication that hunger is increasing. And we know unemployment has increased. So we expect hunger to increase. And therefore, malnutrition is going to increase in terms of what we are seeing as stunting. So 2016, we had 27% of our children that are stunted. That's chronic malnutrition. And if you look from the 2003 to 2016, there has been a steady increase. So if we project that forward, it's now 2021. We expect that at least a third of our children have suffered from chronic malnutrition.
Now, you're calling this a slow violence of malnutrition, but also pointing out its intergenerational destructive effects. Just expand on that a little bit for us.
Well, this concept of slow violence actually comes from climate change, where we are impacting as our lives on the planet, on the planet itself, destructive impact. Malnutrition is the same thing. It's long-term, it's unrelenting. It's relentless. So for children who are suffering from malnutrition, not only are they paying with their health and their lives now, but they're also going to pay in the future. So a child that is stunted now, we are robbing that child of brain development. We are robbing that child of education capabilities. And in the future, that child is not going to be able to, one, have a health that will support that child. So we see NCDs, non-communicable diseases increasing, diabetes increasing, hypertension increasing, and those children do not grow up into adults that can be functional in terms of earning capacity. So this is the slow violence we are talking about. It's long-term and it's robbing children of their full potential.
Yeah. Now, malnutrition is an all-encompassing term that speaks to, I suppose, undernutrition, which is not getting the necessary and the required nutrients, and overnutrition, which is getting a lot of the unrequired nutrients. Am I correct?
Absolutely correct, Tabo. Firstly, malnutrition is all-encompassing. So it talks about children who are getting too little and they are underweight or they have severe acute malnutrition. Children who are getting too much energy with not enough nutrients. We call this empty calories. And so we see in the context of South Africa that we have both children who are short and too fat. So those are the two big issues that we are grappling with as South Africa. And then we haven't even spoken about the micronutrients, the vitamins and the minerals that children are not getting. And all of these have negative long-term impacts on child lives.
Yeah. Is there a strong bias towards a particular age when we're talking of malnutrition, but also a strong bias towards a particular gender?
Fortunately for South Africa, we do not have a gender bias, so we don't see it that girls are more affected than boys in the sense of malnutrition, underweight. But certainly when it comes to overweight, our adolescent girls are much fatter than our boys. And then secondly, our young children, ages 1 to 3, we see that those children have a peak when it comes to stunting and also overweight. So we know that this is a reflection of poor nutrition during the first 2 years of life. And this is because we have very low breastfeeding rates in South Africa. So child nutrition is influenced also by care practices. And if we don't look after maternal nutrition and maternal health, it bears on children. And that's why we call it intergenerational. The mother's nutrition impacts on the child's nutrition.
Yeah. Now, already, as I mentioned last year, the concern was that the government's plans to fight hunger were flawed. In fact, their strategies as well as their funding of malnutrition in the country was flawed. Now, draw for me a comparison, for example, to what they're doing in Rwanda, because their statistics seemingly showing a level of decrease from 44% in 2010 and now 38% 5 years later, showing some kind of trajectory that they are on the decline. What are they doing in terms of their plans compared to what we're doing?
Firstly, we must understand in terms of the Rwandan context. In the Rwandan context, we have mothers and babies that are still very much in a unit. In South Africa, we have 12% of our children under the age of 2 years that are not with their parents. So most of our mothers are either working, looking for work, leaving their children in the care of another caregiver. And that has a huge impact on child feeding practices. So what we want to see in South Africa is maternity protection, not only for the working mothers, but also mothers who are unemployed, mothers that are in the informal sector. While we do not have paid maternity leave, we will see children being separated from their mothers. And the minute children are separated from their mothers, we have to look at alternative feeding practices, because when you're not with your baby, you can't breastfeed your baby. So our children are exposed to poor infant feeding practices, starting with poor breastfeeding, early introduction of foods. So children who should not be eating are already eating at 2 weeks, at 4 weeks. This is unacceptable. We need our children to start good dietary practices. And what Rwanda and many other countries have done is they've invested in maternity protection. They've invested in protecting the food environment for children. And that's what we are calling on our government. At the same time, we know that we have a large percentage of the South African communities that depend on the child support grant. And the child support grant is below the poverty line. What that actually means is that the child support grant cannot afford a healthy food basket. So therefore, these children are going hungry. And that influences the stunting that we see. And we've seen that it's unchanged for the last 20 years. So we would like government to reinvest in children and to secure children's nutrition as a priority.
Yeah. I mean, the real danger here is that if you're saying it hasn't changed for the last 20 years, we've had children who were born 20 years ago who actually suffered this. Maybe if they managed to survive, they are now 20. But the repercussions of their malnutrition are probably still being felt even now, because you're saying they become felt even later on in the stages of their lives.
Absolutely. And that's the point the child gauge makes, is that we are not just talking about children now that are suffering from malnutrition, but we are talking about generations of children. So those children that we have had in our survey since 1993 and the results of 2016 is a generation. In South Africa, the early age of childbearing starts around 21, 22. And so you are right. Those mothers who were stunted are probably overweight mothers who are giving birth to low birth weight babies who are going to become stunted babies. And so this intergenerational malnutrition is actually a poverty trap. And if South Africa wants to compete in the global economic space, we need to put nutrition central to development. And that's what the child gauge is positioning, is that nutrition is not just a health issue, but it is an economic and a social issue that bears down on children's rights.
The authors, as well as the partners of this report, UNICEF, Human Rights Commission, etc., are calling on government to take the report seriously. I know that is not by coincidence. I mean, they sure want to drive a point home here to say, take this report seriously. Why are they making that particular note?
Because, Saba, we need to stop child malnutrition. If we do not, we as a collective country, as government, as civil society, as academia, we become bystanders. We become part of the problem. We need to be part of the solution. And in the words of our own president, we need to be a country that does not allow children to go hungry, that does not allow children to bear the burden of malnutrition and future generations to bear that burden. We need to put children first, and we need to put nutrition as a central development responsibility and priority.
Dr. Chantel Witten, appreciate your time. Thank you for joining us tonight. She's from the University of the Free State's Faculty of Health Sciences, bringing us to the attention of this report, the South African Child Gauge Report 2020. Partners and authors of this report, about 63 of them, calling on government to take this report seriously because often experience that the effects of malnutrition is intergenerational and quite destructive.